Hello, I'm Dr. Jimmy Douglas, and this is an important topic. So watch till the end to know everything about high blood pressure or hypertension. Blood pressure is the force of blood flowing through your blood vessels, and when this is consistently high, it's referred to as hypertension or high blood pressure. Here we are referring to primary essential hypertension, which is the term applied to 95% of hypertensive patients in whom elevated blood pressure is due to complex interactions between multiple genetic and environmental factors. The other 5% of hypertensive patients are hypertensive because of some identifiable cause. You all are familiar with the normal blood pressure number, which is 120 by 80 mm of Hg, where mm of Hg is millimeters of mercury, which is the standard unit of measurement of pressure. The upper number is the systolic blood pressure and the lower number is the diastolic blood pressure. Systolic blood pressure indicates how much pressure your blood is exerting against the walls of the arteries when the heart beats or contracts. It rises steadily with age. Whereas diastolic blood pressure is the pressure exerted when the heart is relaxing or resting between beats. American Heart Association says that the risk of death doubles for every 20 mm of Hg increase in systolic BP and for every 10 mm of Hg increase in diastolic BP. You may not have heard of people dying from high BP, but from heart attack or stroke. But remember that high BP is the major risk factor for heart attack and stroke. Now that we know what the numbers mean, let's see what normal and high values in the blood pressure chart mean. How to know if you have high BP? Not until you get it checked. It's also called silent killer, as there are no symptoms. You wouldn't know until you get it checked. Headache as a symptom is non-specific and caused due to many other factors and may appear when BP is 180 by 120 mm of Hg. If it is so, then it's a medical emergency. Each one of you watching the video has different medical history, different family history of diabetes, hypertension and heart disease, and the level of stress only you are aware of. Since it's the leading cause of heart disease, stroke, kidney disease, vision loss, we got to get it checked regularly. So, when do we start? AHA recommends that it should start at age 20, and if normal, then check every 2 years, depending upon your risk factors or advised by your doctor. Most of you would come to know about your high blood pressure when you visit your doctor for some other medical condition. From today onwards, make it a point to get it checked. How is blood pressure checked? It can be checked either with sphygmomanometer or digital BP apparatus. This is mercury sphygmomanometer used by healthcare providers. This is the gold standard for measuring blood pressure. As everyone is not trained to use mercury sphygmomanometer, and vast majority of the people have to monitor the blood pressure and get it checked regularly, so it is advised to use digital BP apparatus at home to check. Upper arm cuff is recommended with correct cuff size. If you have bigger arm, then make sure the cuff encircles more than 80% of the arm circumference. Now let's look at the important points before checking your blood pressure at home. Choose a quiet place and a chair which has a backrest. Unsupported back may increase diastolic readings. Keep both the feet flat on the ground and don't cross the legs. Crossing of legs may increase systolic blood pressure. Stretch your arm on a flat surface with palm facing up. No smoking, no exercise, nor caffeinated beverages or medications 30 minutes prior to measurement. Measure it twice before breakfast and twice before dinner, and no talking before or during taking the measurement. Upper arm at the level of the heart on the table. If it is below the level of the heart, reading will be too high. If it is above the heart level, then the reading will be too low. Wear the upper arm cuff and sit quietly for 5 minutes and then take the first reading. After first reading, wait for a minute and then take the second reading. Note the readings in a diary and show it to your doctor on the consultation day with your BP apparatus. You checked your BP at home and got a high reading. Now, what causes the BP to rise? Factors like age, sex, genetic factors, and ethnicity cannot be changed. But we can definitely change the lifestyle and eating habits, and those which are modifiable to cut down the risk. So the question is, are you hypertensive or not? You're not going to diagnose yourself whether you are hypertensive or not, but your doctor will do that for you by assessing your risk factors, your medical history, and take your BP recording for a period of time with a well-calibrated mercury sphygmomanometer. Home BP measurements, which you have taken at home, help in differentiating white coat hypertension and masked hypertension. White coat hypertension is when your BP is normal at home but high in clinic, whereas masked hypertension is when your BP is normal in clinic but high at home. Remember to carry your BP recordings when you visit your doctor. If you had a recent stressful event or a situation, your BP reading might be high and would eventually come back to normal. So, a single elevated high BP reading is not sufficient to establish a diagnosis of hypertension. Patients whose initial BP is in the hypertensive range exhibit the greatest fall within the normal range during the first and the second encounter, except in medical emergencies when the BP is 180 by 120 mm of Hg. But in not so severe cases, your doctor will take a series of measurements of blood pressure since readings can vary and tend to regress towards the mean with time. Care has to be taken in establishing a diagnosis of hypertension as soon as possible, since a 3-month delay in treatment of hypertension in high-risk patients is associated with twofold increase in cardiovascular morbidity and mortality. These are the American Heart Association recommended measures to take if you find your reading in the respective category. Imagine your BP is in the higher range, and since you don't have any other risk factors and your advised lifestyle changes, so let's see how to lower high blood pressure naturally without medicine. This happens to be the most searched topic. Most of them are used to taking tablets for 5 to 7 days as advised by your doctor for an infection or any condition. But when you hear that the BP medications are to be taken lifelong, then it doesn't go well. Then you start searching for the ways where you can get the BP down without medications. So this is usually the time when the patient starts exercising or starts eating healthy. Let's see what lifestyle changes to make to help you lower your BP without medications. Sleep is important. Most people need 6 to 8 hours of sleep each day. Too much or too little is harmful. If your sleeping pattern is disturbed, try and make it a priority to get it on track. By exercising, you can reduce your BP. So the approximate systolic BP reduction would be in the range of 4 to 9 mm of Hg. Those watching the video are of different age groups, different BMI categories, and different health history. So talk to your doctor about the appropriate level of physical activity which is good for you. Just because you are recommended a jump rope video doesn't mean you have to jump rope suddenly. So talk to your doctor about what exercises you should be indulging in. If you're leading a sedentary lifestyle, then you should start very slowly. Maybe a 5-minute walk in the morning and a 5-minute walk in the evening would be good to begin with, and slowly increase the duration and be active. The recommended duration is 150 minutes moderate intensity aerobic activity or 75 minutes of high intensity aerobic activity per week, or combination of moderate and high intensity spread throughout the week. You can add moderate to high intensity muscle strengthening activity like resistance or weights on 2 days in a week. Aerobic activity or cardio gets your heart rate up and benefits your heart by improving cardiorespiratory fitness. When done at a moderate intensity with these exercises, your heart will beat faster, you will breathe harder than normal. When you are still able to talk when you are exercising, then think of it as medium or moderate amount of effort. High intensity or vigorous intensity activity pushes your body further, require higher amount of effort, you will sweat more and won't be able to talk much without getting out of breath. Weight loss. By losing weight, you can reduce your BP. Approximate systolic BP reduction is in the range of 5 to 20 mm of Hg per 10 kg weight loss. This is an important topic and we have a section dedicated to weight loss. Go check them. Weight loss reduces the strain on your heart. Being overweight puts extra strain on your heart by increasing the risk of developing high blood pressure and damage to blood vessels, leading to serious health threats. In general, each kilogram or 2.2 pounds lost, then your blood pressure reduces by 1 mm of Hg. Men are at more risk if the waist measurement is greater than 40 inches and women greater than 35 inches. These numbers vary among ethnic groups. Remember, waist measurement is at the level of umbilicus. Adopt DASH diet. Approximate systolic BP reduction is in the range of 8 to 14 mm of Hg. DASH is dietary approaches to stop hypertension. Consume diet rich in fruits, vegetables, low-fat dairy product, and reduced content of saturated fat and total fat. Dietary sodium reduction. AHA recommends no more than 2300 milligrams a day, and ideal limit would be 1500 milligrams per day for adults, especially for those with high blood pressure. Table salt or sodium chloride is approximately 40% sodium. So 6 gram of table salt contains 2.4 gram of sodium. Learn and start reading labels on foodstuffs, as most packaged and processed food contain more sodium. Here in the food label, you can see salt as 1 gram. Even though it may look less, but 1000 milligram is equal to 1 gram. So start checking the labels. Sea salt and table salt contain the same amount of sodium. You can check our article on irastoWorldHealth.com on salt or sodium chloride. Moderation of alcohol consumption. No more than 2 drinks per day for men, and for women and lightweight persons, no more than 1 drink per day. Why women and lighter weight persons recommendation is low? Because of the lower volume of water in their body. Here, beer, wine and whiskey, which are of different quantities, have the same alcohol level in them. Quit smoking and manage your stress effectively. So who should be treated with medications? All patients in whom blood pressure reduction would appreciably reduce the cardiovascular risk with acceptably low rate of medication associated adverse effects. Several international guidelines recommend lower thresholds to start the medications in patients who have high cardiovascular risk. Talk to your doctor and he will assess your cardiovascular risk and then plan accordingly. There are 6 classes of antihypertensive medications which are suitable for initial therapy. Your doctor will decide based on safety, tolerability of the drug, and your existing medical condition. Thank you for watching. Click on the subscribe button and get notified by clicking on the bell icon. See you in the next video.